Good afternoon, and thank you for joining us in the latest webinar in ENO's Road to Recovery series, which brings you leadership and transportation lessons for a post-COVID future. I'm Brianne, a senior policy analyst at ENO, and let me just say I'm really looking forward to today's discussion because prior to my time working in transportation, my educational background is actually in behavioral science, and I really think there's a lot that the transportation policy field and that practitioners can and should be borrowing from psychological and behavioral science research, especially now in this COVID context. Behavioral scientists have long studied how people make transportation decisions that are better for their own health, the health of the environment, and for their safety. In this webinar, Dr. Ashley Whillans, an assistant professor in the Negotiation, Organizations, and Markets unit of the Harvard Business School, will walk through what these insights might mean in the context of a pandemic. Dr. Whillans will be joined by Jessica Roberts, Principal and Programs Manager at Alta Planning and Design. Jessica has 2 decades of experience in transportation demand management, more recently applying a behavioral lens to this work. Just a quick administrative note, our speakers will present for roughly 30 minutes, during which you can submit questions using the questions function through the webinar at any time. We'll then go to about 15 minutes of Q&A, and you can, of course, submit questions then as well. We'll try to hit as many of them as we can. And with that, I'll say take it away, Ashley and Jessica.
Great. Thank you so much for taking the time today to engage in this seminar. We're really looking forward to having discussions with everyone on the line. So we're going to be talking about how human decision-making affects the post-COVID world, and in particular, applying the insights from behavioral science to transportation decisions in the context of the current crisis that we're all facing. So the main objectives of the webinar today are first to start by providing a high-level overview of behavioral science. So we're going to be looking at an Easte Framework and apply that framework to transportation. And this is really just to ensure that we're all on the same page about the framework and the approach that Jessica and I conduct our research from. Jessica is then going to walk through 2 behavioral science concepts that we think are particularly relevant to consider in the context of COVID. That is the fresh start effect and commitment contracts. And then I'm going to end the formal part of our presentation pre-Q&A by talking about operational transparency. And so we're going to move away from behavior change to something foundational and fundamental, that is how to build and maintain trust between organizations and the constituents that they serve, using the principles of behavioral science by highlighting the role of operational transparency. And so we've already covered this, but this is the outline. I'm going to talk quickly about the Easte Framework, Jessica's going to talk about fresh starts and commitment contracts, and then we're going to talk about communication in the age of COVID. So the Easte Framework is really a fundamental framework from the behavioral science literature that seeks to understand how we might be able to leverage insights from psychology to help people change behaviors in a way that's in line with their best intentions, their goals and aims, hopes and dreams that we don't always follow through with. This framework, the full report, is available on the link that will be shared via these slide decks at the end of the webinar. So when we're thinking about behavioral science and the principles of behavioral science, it's important to recognize quickly the historical framework or context by which behavioral science has, been developed. So, in general, policymakers have used to design policies operating under the idea that people were like Spock, that they were rational actors, considered full information before making their decisions, and then acted in line with this full information and with their best intentions. However, there's growing recognition across the social sciences that people's behaviors are not as rational as we would hope, and that sometimes we act more like Kirk than Spock. What do I mean if you're not a Trekkie? Well, okay, so I'm going to break this out a little bit. So what I mean by this is traditionally policymakers designed policies and programs for rational actors who responded to economic incentives or the risk of incrimination, who updated their beliefs in response to new information and acted consistently with their knowledge and values. However, we know that people in general, and in specifically even ourselves, are not necessarily rational. So people are emotional, they often make intuitive feelings because it feels right, or they follow the crowd and do what other people are doing. We also know that people are not very good they find out new information, they get stuck in inertia, making the same decisions over and over again, even though they wish to change course. And they often make decisions that are inconsistent with their values. In the context of transportation, what we often see is that people say that they want to engage in sustainable transportation options, but they continue to jump in their car on their way to work because it's the way they've always done things. And so the Easte Framework is a way to understand how to apply the insights from psychology, sociology, and economics to help build programs and policies to help individuals, well, to really help leverage these psychological biases and help individuals act in line with their best intentions. So the first part, this framework says that in order to get people to engage in programs and policies and uptake new behaviors, that we need to make these programs and policies easy, attractive, social, and timely. What do I mean by each of these? So when we design programs and policies, we should make the decision-making easy. People are easily overwhelmed by information, and so we need to make our decisions easy and free of friction. This principle is particularly important in the context of COVID. This is because all of us are feeling very insecure. We're not uncertain about what kinds of behaviors we should engage in. And so right now, and we're also being bombarded actually by a lot of different information from different sources. So what this means is that when we're trying to present people with information to try to get them to uptake a new behavior or maintain positive habits that have occurred during the work from home period, such as continuing to bike or take transit instead of taking one's car or walk to work, that we need to make sure that the information we're presenting is easy to understand and digestible, particularly in the current context. We also need to design programs and policies that are attractive. So we want to draw people's attention to the solution. People are much more likely to do something that their attention is drawn towards. So it's going to include images, pictures, personalization. People also, unsurprisingly, like free things like lottery prizes and certificates. And so non-cash rewards can also play a key role in motivating behavior. The third is something I've already mentioned, which is social. So people care about what other people are doing and what other people think. So providing social norm information models and asking for public commitments, which is something Jessica will talk about in a moment, is an effective way of getting people to maintain or change their behavior. This is, again, especially important in the context of uncertain times like what we're dealing with right now, where we don't actually have descriptive norms. We don't necessarily know what other people are doing. We also don't know what we should be doing. So in this case, so appeals to social information where we tell people what other people are doing and what their peer groups are doing might be particularly important in the context of COVID. And finally, the last solution that we want to keep in mind as we're developing our programs and policies is to make solutions timely. So people are present biased. If there's any way you can help them act on their best intentions now in the moment and have those behaviors have benefits for right now as opposed to down the line in terms of drawing attention to benefits that can happen in the here and now can be particularly effective. And also we want to be capitalizing on periods of time in which people are already changing their habits. So in the case of COVID, as right now, people are not commuting to work or their habits have been disrupted. And as Jessica will kind of mention in more detail, this might be a particularly good time to encourage people to change their behaviors as related to transportation. So just a few very quick examples. So applied to transportation, we found that it's one way to make transportation decisions easier is to provide individuals with personalized travel plans. So not just suggesting that people bike or walk to work, but actually showing them the direct route. This can be an effective way of getting people to shift their mode of transportation. In our case, we found a 7.1% reduction in single occupancy vehicle commutes and a 6.5% increase in sustainable trips when we provided personalized travel plans to college students on campus. This study also capitalized on making the program and making alternative modes of transportation attractive. We personalize the route. Again, people like it when appeals are directed to them in particular. And we also highlighted the benefits as well as the costs of driving. So we made the decision feel particularly attractive to users. We've also done this in the form of communication to the behavioral insights team, a large nudge unit in the UK, rewrote an email just to make the call to action very clear, highlighting that participants would get a free transit card, and then made the emails much simpler, therefore more attractive than they usually were. And just rewriting this email made people 11% more likely to redeem the pass in the context of the City of San Jose's Eco Pass program.
Hey, Ashley.
Yeah.
I may have misspoken when I passed this on to you. It made them 11 times more likely.
Oh, okay, great. Thanks,
Even
Jessica.
more amazing.
It's even better. Thank you so much.
Yeah.
Great. And then finally, a great example from one of Jessica and I's colleagues, Elspeth Kirkman, found that in the context of a program, Jessica, this was in Portland, right?
That's right.
Yeah. So in the context of a Portland, targeting people who had just moved to let them know about the bike sharing program was more effective than just simply targeting people with mail outs who already lived in that area. And again, this attests to the importance of communicating to individuals and trying to get them to change their behavior when they're already changing habits, such as when they're just moved and they don't exactly know how they're going to get from point A to point B. So I'm going to let Jessica talk a little bit more about how we might be able to exploit particularly timeliness in the current COVID context and the behavioral science behind why we might want to reach out to our program users now before they start going back to old habits. So Jessica, here, I'll let you take over.
Yeah, so we're going to spend a little time talking about habits, and the TLDR is that habits are a lot easier to make than to break. So what is a habit? It's a learned sequence that has become automatic through repetition. And it has three components. There's a stimulus, which we might see as the context, that cues us then to take a certain action for which we receive a reward. We do it again, and the more we do it, the more those neural pathways are strengthened and the more automatic that behavior becomes. And in the context of driving to work, a reward doesn't have to be someone like literally hands you like a bonbon. It can simply be that you arrived at work in a way that felt physically comfortable to you, that didn't maybe challenge your identity or make you experience any discomfort in an amount of time and for an amount of money that felt reasonable to you. So the more people do this, the more they've strengthened it. Now, sometimes, as Ashley already alluded to, people don't want to be doing what they're doing, or at least some part of them wants to do something different. And that's called the implementation intention gap. I'm sorry, the intention implementation gap. And there's a lot of research in behavioral science related to that. But as long as the stimulus and the reward remain the same, no matter how badly people want it, they're unlikely to succeed in changing that habit. And that's particularly the case if the status quo, their habit, is something that's easy to do or pleasurable in some way, and the thing they want to do, their intention, challenges them in some way, requires sacrifice or discomfort or some kind of hassle. So let's talk about disrupting habits. And generally speaking, that is a field, if you want to do some research, you should use the term habit discontinuity. So let's talk about what habit discontinuity might involve. Well, one thing is that the action simply becomes unavailable to you. Your car breaks down. There's work on road work that has closed your regular route to work. Maybe if you take the bus to work and they change the bus route and it doesn't go in front of your house anymore, it's literally not an option. That will disrupt your habit. You just can't do that. So it's very direct. And or we can look at the reward part of this. So maybe your rewards change. Maybe your parking used to be free at work and it no longer is, or maybe you used to pay up front for a whole quarter or a year of parking at once, and then you were like, oh, I'd like to get my money's worth, but now you have to pay every day, and that makes you think a little more about it. Or maybe congestion has resulted in your trip taking so long that it has become unacceptable to you. But what we want to talk about today is disrupting the first part, the context or the stimulus. And in particular, in the context of transportation, something that basically everyone will experience multiple times in their adult life. It's going to be a new home location and or a new office location. So let's talk about fresh start effect. That is a principle from behavioral science that applies not just to transportation, but that posits that in general, people are more open to changing their habits at personally significant temporal landmarks. So what do I mean by that? Well, for example, one study showed that university students were much more likely to Google information about the on-campus gym, as well as to show up at the gym at the beginning of a week, beginning of a month, beginning of a semester, as well as after a school break, a national holiday, or a birthday. So they can be externally or personally meaningful to them. Likewise, Ashley told me about a study that people are much more likely to start training for a marathon at age 39, almost as if age 40 were a temporally significant landmark. It's important to note, though, that fresh start effect really only applies if people see the change that they're engaging in as taking them from a more negative current self and transforming it into something that they feel is more positive in the future. So how does this apply to transportation? Well, there has actually been some research on this. Ooh, we skipped a slide.
Oh, we skipped there. Perfect.
Thank you. Yes, so there's been some research on this. It has all been in the context of moving homes or jobs. But one study showed that people who had recently moved homes were offered a welcome packet that included a free transit card, and more than 17% increase in transit use resulted. Likewise, environmentally motivated university employees, meaning ones who actually didn't want to drive as much as they do, did not change their behavior until the moment when they changed homes, and then they actually reduced their car use. And likewise, drivers in Copenhagen were offered a free transit card, but only those who moved homes or jobs actually took up on that offer and ended up using transit more often. And as Ashley already mentioned, the Elspeth-Kirkland study about a bike share study, a bike share trial offer where people who recently moved homes were 4 times more likely to accept that offer. So this body of research suggests to us that actually the moment when a change has happened in job or home is an under-recognized opportunity, and we'd like to see a lot more research around what can we do with that. And it also suggests that it's a productive line of research to look at other kinds of fresh starts and how we can stimulate them. So that's, of course, the topic du jour. How does this relate to COVID? Well, we've experienced a huge shock to all 3 of those components of habit, to our context and stimulus, to the options that we feel are available to us, and to the rewards that we receive by them. And in response, unsurprisingly, massive global change in travel habits. Driving is way down. We're all enjoying the cleaner air, the quieter streets, and the reduction in traffic deaths that go along with that. But we're all expecting that at some point in the future we'll be able to leave our homes again. So what happens then? Well, we see it as there are 2 groups of people to whom the fresh start effect might apply. And one is the people who used to drive to work every day and are now biking and walking in unprecedented numbers, probably not for commute reasons. It's more to keep themselves sane and healthy, but they are definitely walking and biking a lot more. And literally everyone on the entire globe who can work from home is working from home now. So an unprecedented shift in increase in teleworking. So we now see the opportunity to strengthen these habits for people and to make them resilient so that when things change in the future, hopefully a meaningful percentage of these people will continue with their new habits. Then there are the people who used to, let's say, take transit or carpool or vanpool to work, and who now, if they're going to work, are driving alone, or perhaps for the time being are teleworking. But as their workplaces reopen, it's not going to be good for our cities, and it's not going to be good for the environment if all of those former transit users and carpoolers get in their cars. So for these folks, we need to think about how can we actually stimulate the feeling of, or take advantage of actual fresh starts that are happening. Of course, all of this aligned with public health and government guidance, right? But we think that the big opportunity here is likely to be working with employers as they change their workplace policies. Changing gears a little bit, we're going to talk about commitment contracts. You'll recall I talked about that intention implementation gap, and this is one of the best studied and most robust interventions that can help people through that. So the first step in a commitment contract is helping people visualize what they're going to do. And that's like literally, what are you going to do, with whom and when, as well as the emotional component of it. How will you feel if you succeed? How will you feel if you don't succeed? The next steps relate to planning and anticipating barriers. So the planning is just breaking it down into enough baby steps and doing whatever research and decision needs to happen up front. Let's say I've never taken the bus to work. That's what I've decided to do. Well, I might need to know some things. Which bus takes me to work? Do I have to transfer? Where's the stop? What does it cost? How do I pay? So really thinking through all of those things and making sure people have the complete information that they need. And then also anticipating setbacks that may arise and having them think through in advance how they could overcome those challenges as they come up, and that they keep them in their back pocket so they feel more confident that they will in fact be able to succeed. And once they've gotten that far, then we want to look at setting a commitment. So that has to do with making a specific and measurable goal. So literally, what mode are you going to use? How often are you going to do that? Let's say it's a commute, right? Like, so how many days are you going to do it? 3 days? Okay, great. What is it going to be? Same mode every day? Oh, you're going to bike. Okay, great. Specific, measurable, and then going to the additional step of making a public commitment and agreeing to receive feedback and reminders. So that might look like, let's look at the next slide. This is from a study that's currently being done. Ashley and I are advising, and it's being led by our colleagues at the Center for Advanced Hindsight at Duke University. And it's with a public agency that offers employees the opportunity to earn additional time off by basically not driving to work. So in this case, our colleague Joey is like, well, I'm going to commute 8 times per week, meaning, 4 days per week by bike. I'm going to sign this commitment. That will be shared with others, and I will receive feedback. So here's a summary slide of all of the components of a commitment contract. It basically, helps people strengthen their intention as well as build their self-efficacy, which means their confidence that they will in fact succeed in doing this thing that they have set out to do. But we think it's really important to cast our mind back to that 3 parts of habit formation. As long as the stimulus or context and the reward remain the same, even the power of the commitment contract may not help people enough to overcome the powerful pull of these ingrained habits. So it's important to consider that entire life cycle and think about how we can be tweaking all components of that. A good example would be that we think a commitment contract might be like peanut butter and chocolate with a fresh start effect intervention. Because if you're looking to contact someone right when they've changed jobs or homes, well, what intervention are you using? This might be a very good one. So it's not an either or. They could go together very, very logically and nicely. And this is something that we're really interested in doing more research on. And we have some studies in the hopper, but we're actively looking for other partners. So let us know if that excites you.
Great, thanks, Jessica. So as Jessica has really outlined, and I hope that some of the examples that we've presented also highlight, behavioral science has a lot to say about how to help people follow through and engage in new, healthy, and sustainable habits, especially during moments of change, such as the current COVID context. However, it isn't up to individuals alone. Organizations also have to build trust between themselves and their constituents. And really trust, as some of my colleagues have pointed out, is the foundation of behavior change. If an individual does not necessarily trust the institution or organization implementing a behavioral science intervention or a messaging campaign, they will not follow through on any of the suggestions, regardless of how helpful or potentially useful these suggestions will be. And one element of trust that behavioral science has really understood in the last kind of few years is this idea of operational transparency as being one critical way of building trust between organizations and constituents. So during the COVID situation, organizations are comfortable with communicating their process. However, because it's always changing, and the information that an organization has available to them will be constantly kind of updating as the situation unfolds. However, research on operational transparency, the constituents, the work you're doing to bring them safety, cheap flights, faster pizza, in this Domino's example, is extremely important in building trust and facilitating reciprocity between users and organizations. So what do I mean by operational transparency? So the idea that Mike Norton and Ryan Buell, my colleagues at HBS, put forward is the idea of operational transparency is that you want to make policies explicit and communicate changes to constituents, even if the updates are only progress and not outcomes. So in one study, my colleagues Ryan and Mike explored the effect of showing customers the process versus the outcomes related to cheap flights. And they've also had their hand at the Domino's pizza tracker, which shows users exactly where in the process their pizza is. And what this does is it gives you a window into processes that are often opaque to users, and makes users feel cared for, and they're even willing to tolerate delays and waits, and it helps to build trust and reciprocity. So they feel happier even if their pizza is later, because they know that the company is working on their behalf, in this case Domino's, to help, to get them the pizza as fast as they can. This idea has also been applied to city governments, so showing citizens the progress of road maintenance that they called in about, even if there were delays, communicating why those delays existed, increased customer satisfaction with the municipal government services. And more broadly, this strategy emphasizes the fact that when we share what our organizations are doing, we often talk about what we're doing, but we also need to focus on the why and the how. So this way, by being fully transparent about what you're doing, the changes you're making as you're making them, can help users understand that you're really trying your best, and this can help users understand that you're taking steps to fulfill the request, fix an error, correct an omission or delay. So even when things aren't going exactly according to plan, keeping users on top of what you're doing and why you're doing it, and even if there's delays, can really help to facilitate and build trust and rapport between yourself and the users of interest. So a summary of operational transparency here is that there's really kind of, and why I think it's so important is that there are really no norms for the current COVID context. I think I actually skipped an example that I wanted to show. So Metro, the LA County Department of Public Health and the LA Metro are doing, this is just one example of many. I'm sure many of your organizations are doing something similar, but they're clearly communicating what they're doing in real time. This is a kind of a bar at the top of all of the websites. And they're also very honest and transparent about, the number of cases that have been, come to light as a result of COVID. And I would say that this is, sort of an example of operational transparency because the updates are happening in real time and that there's a lot of transparency around safety. And I think that'll be increasingly important going forward. There is a natural tendency to avoid communicating things that are not going quite according to plan, or maybe you would hope to have faster progress. And the theory of operational transparency really says communicate your process and that will build rapport, even if some of that process includes areas where you're not quite achieving the goals that you set out. As long as you communicate what those goals are and what you're doing to try to achieve them, users will feel more trusting of your organization as a result. So just kind of back to the summary slide, there are really no norms for the current COVID context. So as leaders, we need to communicate which changes we're making and why we're making them. Operational transparency says that communicating progress in real time can build rapport and trust. And one other piece of information about how to communicate messages around changing your operations as a result of the COVID context is to highlight the pro-social element of any of change you're making. So if there's going to be additional delays, not just letting people know what those delays are, but why you're making them. Well, by waiting, a few extra minutes, you're going to be helping keep the community safe. There's been a lot of research suggesting these pro-social messages, as opposed to more self-focused messages, keeping you safe, are more effective in the current context when everyone is trying to do their small part to make a difference and to help their communities in a time of need. So if you have to communicate what you're doing, why you're doing it, and in terms of the frame in which you present the information, the best research to date suggests that you want to really highlight the pro-social element of any change you're making, help people feel like they're helping you help the community by any of the actions that they're engaging in when they interact with your program. Jessica already mentioned from this, but one thing that we've been very interested in is this idea that working from home is one way of reducing congestion and promoting safety during this time. And so and potentially become something that becomes more normal as we all shift back to work. So we're conducting research right now to understand what are the factors that really help all employees survive and thrive in the work from home environment as a way to broadly promote employee well-being. And we've been doing some research, but if this is something of interest, we would really be excited to learn more, hear what you're doing, and potentially partner on some projects related to this. So far, what we've been learning in our qualitative and quantitative research is probably something that rings true to many people, and myself included, that work-life separation, these mental transitions, commuting used to play a major role. We'd have a mental transition from our work selves back to our family selves, our personal lives via our commute. And these kinds of transition times no longer exist. So what we're learning from our research so far is that employees who can work from home no longer no longer have the breaks and transitions that they used to when they were working in an office. And so we need to help people build in breaks and transitions and encourage water cooler talk. This is something else that's coming out in our interviews. So these informal conversations not only improve the quality of the work, but also reduce burnout and seem to help employees feel connected when they're all, when Zoom meetings are not quite maybe the best mechanism to produce team cohesion. So overall, our research is suggesting that rituals matter, creating separation between work and home, even when we're working and living in the same space, and building in breaks, boundaries, and virtual huddle time or informal interaction seems to be some potential points that are worth further exploration as work from home continues into the future. So I think this is the end of our formal presentation and slides, and we are very excited to see where the conversation goes in terms of questions for the next 15 minutes.
Great, right on time, and I'm excited for Q&A as well. Don't forget, you all can continue to submit questions. A bunch have already come in, so what I'll try to do is kind of summarize those, like lump them together a little bit so we can hit on broad themes. So we'll start here with the first one of how might you respond to someone who is skeptical that individual behaviors will be enough to produce meaningful or lasting change? So in other words, why focus on this very micro perspective when macro policy changes might produce quicker or more widespread results? Maybe start with Ashley, but if either of you wants to jump in, that's fine too.
Yeah, so the way I like to think about this is the way that, I was trained and I used to work in government, and this is how we sort of talk about this. Is by no means are we saying that this is the only approach. This is rather one tool in the toolkit, if you will. And we need to understand what resonates and lands and how to design, programs. And so we need to understand these micro level phenomena to build programs and policies that are likely to be uptaken by citizens when they're rolled out at scale. So a lot of the smaller decisions around the margins that we're talking about have non-trivial effects on behavior and are things that we can modify and test in order to make program and policy design the best it can be when rolled out and implemented at scale. So I see that the micro level phenomena and behavior that we look at as one piece in a broader puzzle, and that a lot of these small changes around the margins, when implemented in rapid iteration in many touch points, can really improve the efficacy of processes, and the kinds of experiments that we have been talking about allow for this rapid iteration process, which can then be scaled and when can have quite significant impacts. So by no means are we trying to say that any of the interventions that we've discussed today supplant policy or implementation changes, but rather are one tool for understanding how to best implement policies at scale that are likely to have their best intended impact. I'll let Jessica see if she has anything else to add there.
Yeah, I do. I agree with all of that. I'd also say that not insignificant investments are currently being made in programs intended to change the behavior of individual commuters. And if we don't examine the efficacy of those, that is potentially wasted money and time. So I would argue that these sorts of strategies can make anything that we are investing in, it can hold us accountable to make sure we are evaluating the impacts as rigorously as possible. And by using some of this, iterative trial approach from behavioral science, we can build much better programs. That said, we talk a lot in our research collaborative about the fact that if the entire decision-making context that people are responding to makes driving alone truly the better option, the objectively better option for most people, then our work a nudge can't overcome, an entire system, like a scale that's badly out of balance. So yes. One of the questions we have is, where is this approach, this behavioral science individual behavior change approach, where is it appropriate, where is it effective, and what are the contexts in which it isn't just swimming upstream, right? So for example, if you are trying to do an intervention, let's say at a university, but they still have free parking or like ridiculously underpriced parking, I always would caution our partners that we can probably help you, but you're sort of shooting yourself in the foot from the get-go. So I think there is, it is really important to acknowledge that if we make, you know, driving alone the fastest, the most comfortable, the social norm, and the cheapest option, we should expect rational people to respond to that. So that doesn't mean that we should abandon all of this work, but I think it does call for the importance of upstream policy work. And there I see a huge untapped opportunity to apply behavioral science to policy setting, because the people setting policy are humans. They have the same rational biases. They fear getting out of step with the social norms of their peers. I mean, I look at some of the mayors or the governors who have followed the lead of the states and cities that surround them on some of these COVID actions, but didn't take the lead, right? So I think we need to be thinking upstream, but still understanding how behavioral science can help us work effectively in that arena.
That's great, thanks. To that end, I'm wondering who you see as the maybe primary or the some of the audiences that this information might be especially useful for. So we've talked about transit agencies, employers. To what extent might individuals themselves benefit from some of this information, or maybe I'm thinking of elected officials? Who are the different constituents that might be able to use this information, and what's the best way to take action on some of this information?
Jessica, did you want to take that first?
Yeah, sure. I think everyone you mentioned is important. I mean, our work is probably, you know, any individual who is motivated, so motivated to change their own behavior of their own accord, sure, they could attend this webinar and be like, I'm going to make my own commitment contract. But that's not really what we're here to talk about. We're talking about setting up systems, setting up programs that use evidence and use, you know, iterative, high quality evaluation to get better, right? So I think we are talking about decision makers and people who set policy and people who have the opportunity to influence large groups of people. The employer is a logical one. Public agencies in general, both in their role as employers, but also in their role as talking with, you know, their constituents, however that's framed, have a lot of opportunities. I would say anyone who has the ability to partner these sort of demand side interventions with supply side interventions. So public agencies that are really integrated in their thinking around transportation demand management strategies that are looking, you know, let's say at parking pricing or at regulatory solutions while they're also looking at programmatic solutions, I think are a really graceful partner for this type of work. And I would say funders. I would really, really like to see funders, whether that's government funders, whether that's foundation funders, champion the benefits of a behavioral science approach and proper testing. And that means allowing program developers to spend real money on evaluation and research. And it means understanding that doing a single trial may have some benefits for that program, but what we really need to build is a knowledge base and a research agenda at the societal level. And that's not really done piecemeal. So I think, you know, Ashley, our colleague Jerry Sherlock at Duke, others, we're really looking for that big picture thinker who is like, yeah, we need a 3 to 5 year research agenda where we're advancing these hypotheses, we're replicating, we're really refining these ideas. And at the end of it, we can start to say with confidence, hey, these solutions seem to work, these ones not worth pursuing.
Yeah, and I'll just add a couple of points on that. I think really where behavioral science came from and where these ideas originated is to develop systems and contexts to help encourage individuals to make behavioral changes in line with their best intentions. So really we want to be thinking at the level of the new employee program you might be rolling out, or the transit pass program that your agency is thinking about. How do we develop decision-making contexts that make it easier for individuals versus leaving the onus up to the individual themselves who have multiple competing demands in their life to follow through on their kind of best intentions? It's how do we create choice architecture around the decision-making context, and that is really where the role of organizations and governments comes in. And I will also say that, Jessica and our team have had a lot of success working with city governments, and that all of these partnerships allow for this rollout at a larger scale, but also allow for iteration of, taking these sort of raw ideas, if you will, from the behavioral science field and then testing what works in any one particular context. We've already been talking about the importance of understanding context for thinking through these interventions are going to work or have the best chance of working. Not only individual context, but also community context. And so that's where partnering at the program level or with cities, with government becomes particularly important. So we can really engage in a longer communication and process to understand the context and then roll out these interventions at scale. So more centered toward the setting up context as opposed to leaving it up to the individual to engage in these behavioral decision strategies on their own.
And that reminds me, Ashley, we are also partnering with sort of third-party, tech app providers, because if you're thinking about the opportunity to scale, doing this one employer at a time is great, but all the better if we can, pilot, refine, replicate, and strengthen an intervention, and then just flip a switch and have that reach every single current and future user of some piece of technology, app, or service.
Great. I'm going to try to hit 2 more questions here with the time that we have left. Wondering how might the Easte framework apply in a world where transit agencies maybe aren't operating at full capacity? So many have cut service or are maybe encouraging distancing on what service they are providing. Or in a world where people are fearful of taking transit because of social distancing mandates. How do you encourage people, should that be the goal, to encourage people to take transit, and what lessons might we have from this work in that context? Jessica, maybe I'll start with you. Or Ashley, go ahead.
I'll just start really quickly because I think Jessica's thought about this question in particular detail, but I will just say that we want to be thinking about using the frameworks to communicate, to keep people generally up to date, even if we're not encouraging the behavior now. So there's a lot that can be done through messaging and communication to get people open-minded, when they're ready to go back, when the things start shifting back to more in-person office environments. So using the framework and the ideas that we've talked about here, and meeting those ideas with where we are, right? So not necessarily trying to shift people's behavior now, but keep them open to the idea of taking transit or taking these alternative forms of transportation when they become safer or more widely used. And Jessica, I'll let you take it from here.
Yeah, I don't think now is the moment when any of us should be promoting, a massive shift to transit usage. I think it is appropriate, it is responsible that transit agencies have pivoted to a message, that LA Metro did it most poignantly, but I think every transit agency says, if you can not take transit, please don't, but if you need us, we're here for you. So they're really focusing on the mobility of essential workers, as well as keeping both those riders and in particular their operators and their employees safe, and that is appropriate, and I thank them for that. That represents a financial sacrifice, but I think it is responsible of them. Moving into the future, we are going to all be looking for those landmark moments of management strategies and changes in sort of the public health context that would allow all of us involved in this to sort of like ethically and morally be comfortable with outright promoting transit again, right? So for example, I think we're seeing that we're learning a lot more about how the virus is transmitted. So I don't take this check to the bank and cash it. I'm not a public health professional, but I suspect we're going to see a continued emphasis on cleanliness of surfaces, but I think we're going to see more emphasis on possibly not talking on transit, universal mask wearing. So we're going to learn more, and that's going to allow us to have more confidence in the management strategies that we use. And I think what we're seeing is that in places that are doing these things, transit does not seem to be a major hotspot. So there's research coming out of both Japan and France that they have not traced any super spreader event to public transit. And I'm not saying therefore there's no risk at all, but I think that in places where people are following public health guidelines, we may see a context where returning to transit is acceptable. And I'd also say that some really forward-thinking organizations, unfortunately most of them are in Europe, but there are some in the US, so San Francisco is really noteworthy on this, are saying our cities cannot survive a future in which people abandon transit for driving. And therefore, now is the moment when we need to sprint and work harder than we ever have to strengthen transit and strengthen active commuting opportunities, so that when we all emerge from our lockdown at home caves, our cities don't become total gridlock.
Great, and hopefully one final quick and easy one for you all. So you talked a little bit about upcoming research that you have. What are the next steps for you? What do you hope to be continuing to measure and assess using these insights? And then along with that, how can there be better connections between behavioral science and transportation practitioners? What do you see as the link there?
So we're currently writing a paper on this exact topic, but I think just lowering the barriers of communication between TDM researchers and researchers in the academic community, which is something that Jessica, I, and our colleague Joey have been trying to actively do. So if you have ideas or you want to chat more after this webinar, reach out. We're findable and are very interested in seeing what we might be able to learn together. So that would be my comment on that point. And then in terms of what we're hoping to learn, I know for me as a time and happiness researcher, I'm particularly interested in how to make work from home a more pleasant, positive experience, to the extent that it's going to be something that's necessary, but also could come up again in the future, and also helps with reductions in carbon emissions and so on. So trying to implement interventions at scale to encourage work from home policies and to make them better work for all employees is and a couple of areas I'm particularly interested in.
Yeah, I think the key is finding real implementation and practitioner-oriented researchers like Ashley and Joey, who really want their work to be useful and are committed to remaining in conversation with those of us who are doing implementation. And then on our side, on the implementer side, it's educating ourselves, it's challenging ourselves to a higher standard, it's talking to our funders and trying to convince them to fund research. And it's, as I said, on the funders and decision makers to insist on this type of work. So I think we're building the community and the movement around this, and we're really interested in connecting with you if this excites you. Actually, would you advance the slide? We're both pretty active on Twitter, so that's one way you might like to get in touch with us. There are many others.
Excellent. Well, thank you both so much. This was really, really helpful. I think, I got a lot out of it. I think our audience probably did as well. So we'll leave it at that, and I'll say thank you. And our next webinar, Empowering a Resilient Transit Workforce, will be on Tuesday, June 30th. So if you're interested in that, you all can sign up for that as well. Thank you.
Thank you.
Great. Thank you so much.